Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Hey everyone, Bradley Bostic here for episode 30 of Boombostic Health. I've got Brent Bolton alongside me today. Brent, you're practically like my sidekick at this point because you've been on before. Thanks for joining again.
You're welcome.
Brent, why don't you just reintroduce yourself quick so folks know where you're coming from and this whole transition you've made from non-healthcare to healthcare. And then that'll help segue into really the primary topic, which is there's so much promise in agentic AI and all these amazing new AI technologies. And a lot of that is we talk about clinical change and making patients healthier. But what's being missed a lot of the time is all this behind the scenes inefficiency that affects patient care, but also just consumes needless dollars, hundreds of millions, billions, trillions, maybe even. So we'll get into some operational applications of agentic AI. But before we get into that, Brent, why don't you just quick introduce yourself again and give a little bit of your backstory?
Sure. Thanks for having me, Brad. So I am VP of Strategic Partnerships here at HC1. And prior to the 12 years that I've spent with this organization, I spent 15 years in the manufacturing setting. I started off my career doing purchasing and then global sourcing, a lot of different forecasting type roles. But that first 15 years or so was spent in various manufacturing facilities all around California. We did a lot of global sourcing, a lot of materials management and operations management. So it was great for me to be able to make that transition into healthcare. But it was also a little bit of a shock for me as well to see kind of how behind the times healthcare supply chain and healthcare operations was versus the manufacturing world that I had spent the first 15 years of my career or so in. And on the side, I do teach supply chain and operations at San Diego State University. And so had a really, really funny moment teaching a course last week where I realized that I had graduated 25 years ago as of last week, and had a little epiphany at that moment about how much things had changed in the 25 years since I started working to this week, essentially. And so I'm excited to talk to you even more about how I think things will change going forward.
Yeah, the change is just accelerating too. When you talk about that, it just reminded me because we're similar vintage of my experience in college where I started an e-commerce company and how e-commerce was brand new. Back then, people felt uneasy about putting their credit cards in to purchase things on the internet. And that was actually one of the main reasons PayPal became a thing is people wanted some extra assurance there. And when I shifted over to healthcare, seeing just how there wasn't any design around customer like there was within e-commerce. And I think a lot of that is paralleled in all these different areas, including more of the back office, like you're talking about with operations and supply chain. So excited to dig in. And I think that's great that you're teaching that course. Is it like a full summer or what's the duration of that?
Yeah, so it's a summer school course, and it's to an MBA class. It's an 8-week class, but it's really focused on right now global operations and global supply chain.
Okay, so do the students call you Mr. Bolton?
They call me Professor Bolton, and sometimes they even call me Dr. Bolton, and I don't correct.
That's amazing. I love that. That's super funny. I've actually had scenarios also where because somebody will tell somebody else that I'm in healthcare, they'll assume I'm a doctor.
Yeah.
And I went with it for a while, and then I was like, oh, actually, I'm not actually a doctor.
Yeah, right.
I'm just in the tech side, dealing with the data. That's awesome. Yeah, keep going with that. You might want to even mandate that. Hey, look, Dr. Dre is not a doctor. He goes by Dr. Dre. So
yeah, it still warms me up inside every time.
That's amazing. It's an honorary doctorate, right? All right, cool. Hey, let's just dive right in. So if you look at healthcare and the back office side of it, and the fact that there's just so much that has to get procured and routed and stored and utilized, and things have shelf lives, and people don't think about this, but it's like a massive business all in and of itself. How has that been managed in general for healthcare systems?
So a lot of supply chain whether it's healthcare or manufacturing, is actually very tactical. There is a lot of looking at future orders, calculating an economic order quantity, determining what we need to stock those shelves to support whether it's retail or a grocery store or a hospital shelf that's got tubes, needles, and everything else you need for those patients that are coming in. So doing that forecasting process, creating the purchase orders, receiving the inventory, moving the inventory, all of that is actually quite tactical. And technology has helped tremendously to automate those processes, reduce the amount of errors, and to improve those workflows. And honestly, just make everything a little bit more efficient and a little bit more accurate. And I think with AI, things are going to be exponentially even smoother going forward, especially on the tactical piece of the supply chain. Here's a great example. When I started my career, right, I was using Microsoft Excel to calculate our order quantities. I would look at historical purchases. I would compare that with upcoming demand, and I would manually create what our order quantities should be going forward. With AI in the future, that won't be necessary for someone like me to be doing, because it's going to be able to look at seasonal trends, look at outliers in ordering trends and ordering practices, smooth out those forecasts. And not only will it be able to calculate what our future demand is going to look like, but it can help to place the orders. And then with the blockchain, even monitor where those supply chain orders are all throughout the entire supply chain. So things are going to continue to evolve. It's going to continue to make supply chain far more efficient and visible. And I'm excited for all those evolutions within the supply chain.
So one of the things that takes a ton of time, as I understand it, within what's you're referring to as supply chain, which is really the purchasing and management, purchasing, transportation, tracking, management, usage of everything that you have to utilize to take care of patients and deal with your facilities, which, as you think about it, is like unbelievable. It's like the Amazon, quantity of items all like in the hospital, all the pricing of those and the service level agreements and all the stuff that's in the contracts. It's really difficult to track all of that. So if you think about generative AI and its ability to assimilate a lot of content and based on what it's trained on, respond with answers specifically, talk about how agentic AI in that type of context would ultimately make it so that you've got like an unlimited amount of like an army of analysts always looking out for your best interest in the supply chain.
Yeah. And the way I think of it is, I'll just use an example again back from 25 years ago. My team used to oversee about 40,000 different SKUs for the manufacturing firm that I work for. And we used to make various different electronic components. And the bad joke was if you've got a bill of materials that has 1,000 items in it, how many items do you need to be able to ship it? Well, all 1,000. Because if you have 999 of the SKUs out of the 1,000 you need, that thing just sits there waiting. And it is terrible to not be able to ship your product because you're waiting on one product that might be a penny or a fraction of a penny. These electronic components.
Gosh, I would have thought it would be more on demand and, batched up based on what's needed at a given moment. You're saying there's like an entire big pack of everything that has to all be ready before anything can get shipped.
Yeah, and not only that, especially with custom orders, right? A lot of that material is not going to be sitting on the shelves, just sitting there ready and waiting. But I think the thing that's so interesting about how AI is shaping the supply chain is the ability to do the predictive analytics and the predictive forecasting of the products that you will need, the products that you don't even know that you need to support that upcoming demand that you haven't planned on yet as an organization. So that's where I think, whether it's for manufacturing firms or for healthcare, just being able to predict the future demand through AI and through improving the forecasting tools, that's where it's really going to help organizations to be prepared for whatever's coming up next. And last thing I'll say about all of this is that the coronavirus pandemic, before that, most individuals never really cared or knew much about the supply chain. We take for granted you go into the grocery store and it's full of items. You go into a retail store and everything you want is there. the pandemic made us very aware that, things aren't always there when we want them, and why aren't they there? And so all of a sudden, supply chain, not just healthcare supply chain, but supply chains in general, got a whole bunch of visibility that they've never had before. And now I think people broadly are aware of the importance of our supply chain and also understand how delicate it is. So anything we can do to improve it and make sure that we don't run into those kind of problems again, I'm all for.
Yeah, I remember when people were stockpiling toilet paper
Right.
because they all of a sudden realized it's not infinite. And it's
Right.
funny now, but at the time it was horrifying. Like you'd roll up into Target, everybody's all masked up, and it looks like there's been a run on the store and it's been looted. Like
Right.
you'd have like old grandmas fighting with other people with hitting them over the head with their cane in order to get a roll of paper towels.
That's right.
So it's pretty wild. I'm going to take just a quick leap out there as well. One thing that occurs to me is that at some point there will be 3D printing that exists at the endpoint where what you're actually going to be purchasing is the authorization to print the whatever the item is off of your 3D printer. I don't think that's that far out. They're already doing that for parts on the International Space Station. I mean, why couldn't we have that be a component of the supply chain in healthcare?
I mean, I would assume the manufacturers are going to have an issue with that unless they can find a way to monetize that themselves, right? If they're the ones providing you with the 3D printers for the products and services that you need. But hey, it's not too far off, right? I mean, if you can literally manufacture something at its point of need during a surgery or some other emergency procedure, if it's going to help save one of my family members, I'm all for it.
Yeah, or even imagine that you've got an ability to make the joint that you're replacing exactly tailored to the individual, especially like smaller people that may not conform to the classic hip. That might be a terrible example. I'm not an orthopedic surgeon by any stretch, but it is pretty crazy. I hadn't really thought about that until right now. I remember when my kids first had a 3D printer and my son, Cal, actually printed out a heart shaped jewelry box that he found it from an existing design, but he brought that into school and for Valentine's Day gave it to his teacher. And he was like in second grade or something. And I remember him coming home and he was like, yeah, she didn't understand like how I could have made this. She was like thinking he probably just is saying he made it, but it was like legit. And that made me realize like at some point, certainly for certain items, you would just print them right out. We're not quite there yet. So getting back to the step that we're taking into AI, there's also this need to have the right kind of training data. And so somehow you have to have gained that training data. Like one of the examples would be the benchmarking information of what the pricing is for a given item and other dimensions. I guess maybe start with like, what are the key dimensions in a supply contract that there's price obviously, but are there others that continuously should be monitored and checked and managed?
Yeah, so price is obviously a big piece of a vendor agreement, but you've got your expiration dates, you've got your economic order quantities, you've got your commitment levels, and then just all the other fine print that goes along with any kind of agreement. And there's already some pretty impressive tools out there that help to make sure that the agreements that health systems have now match up what is delivered and what is invoiced and those kind of things. What I think will be interesting going forward is how we can use that data to evolve our supply chain contracts to make sure that, simple things like there's, with many agreements, there's a cost tied to various indices. And it's all very manual and it's all done reactively. But what if we could have those costs and those agreements updated in real time to match with those indices? And those are just like little improvements that will make a big improvement to our health system partners because in other areas of various other industries, costs are going down. Costs aren't necessarily skyrocketing like they are in healthcare. And so, if you can tie various commodity indexes to the price of those vendor agreements, then it's really going to be beneficial for those hospitals and health systems.
Okay. So, with respect to these different things you need to benchmark against, it takes a whole bunch of work to comb through the contracts and find all the the provisions, and it's discrete data, but it's in there somewhere, although I suppose some of the provisions would be written in different ways. How can you envision, or how are we moving toward at HC1 specifically, the future state of that? And then, how can the people who are historically manually going through all that information to try to find those needles in that haystack apply their energy differently, higher value tasks once that's in place?
Yeah. So specifically HC1, the data that we have, the lab data for supply chain, there is no other technology solution like ours. Not only do we have small rural health system cost data, medium-sized health system data, all the way up to some of the largest health systems in the country like Advent Health and Common Spirit and UNC and Bon Secours Mercy Health. We also span between every single GPO. So whether it's Health Trust, Premier, or Vizient, we have all of that data at our fingertips. And so we already have a lot of that data, but how you actually use it to leverage your supply chain negotiation is a whole different ballgame. So you've got to start with the data. I mean, that is the focal point, like that is the starting point of any discussion. But then having the people and the process and the leverage to be able to get the best supply chain deal or the most value created from that upcoming relationship, that's where partnering with a firm like ours is really helpful because we've got pretty much every area covered between the subject matter expertise, the processes, the leverage, but it all starts with that data. And that data can be pulled. I mean, you can go to just ChatGPT right now, drop in a 30-page agreement and say, find me these 5 or 6 different metrics, and it can do it. But most health systems are only going to have their data to pull. So they're not actually benchmarking against anything except for maybe the benchmarking database they have, but it's also limited in scope as well. Where we've got that major leg up is we partner with almost 25% of all the health systems in America. And again, there's an amazing amount of variety between small and large and the various GPOs. So we have a benchmarking database unlike any other service that's out.
That's so cool. And when we talk about a benchmarking database, is this something that just gets locked in once a year, or are these benchmarks continuously changing? And if so, what is driving the change that happens within the benchmarks?
Yeah, I mean, hopefully we are the ones driving that change. That, in the spirit of bad jokes, I hope that every single one of our customers will have the new lowest price, right? Because we're compensated by cost savings. We get, our fees are contingent on us driving savings. So we want that benchmark to go lower and lower and lower and lower. And so we are updating our internal database in real time so that if we're talking with a chemistry provider on Monday that gives us a new price, by the time we're talking with a different vendor on Wednesday, we already know that data and we know that that price point has changed.
And is there a quality benchmark that's tracked, or is that not part of this really?
I mean, I know our operations team definitely monitors quality. So when looking at the clinical lab operations, right, there's going to be turnaround time, there's going to be workforce optimization, there's going to be reject rates of reagent kits and consumables. Supply chain, I don't know if we're there yet, but we do monitor on-time delivery and inventory levels. So kind of, closely tied to quality, but not necessarily.
Got it. Interesting. So when you look across all the health systems and healthcare entities labs that you've been able to work with and our team has worked with, we're talking about what, like hundreds?
Oh yeah,
And I think I've
thousands.
seen some pretty big numbers in terms of savings, like 250 million, or is that what are the numbers in terms of how much cumulatively these programs that our teams, and this isn't a self-serving thing at all, I'm just like, this is a fact that's important, how much has been saved across the clients that we've calculated so far?
Yeah, I mean, it's well over $100 million. And clinical lab is the lowest, it's one of the lowest spend areas within a health system. They might spend more in office supplies, literally paper, pencils, staples, than they do in lab reagents and send outs. And that's crazy to me, considering that something like 75 to 80% of all patient, diagnoses has come from the clinical lab. But when you're looking at it from a cost perspective, it's generally only around 4% of their supply chain spend. So to be able to take out that, 200-ish million dollars that we have been over the last decade, we're talking a few million here and a few million there, but we've pretty much been successful at every single partner that we've had, 50 plus partners over the course of the last decades. When combining our data, our processes, and the leverage that we have, because we oversee $1 billion worth of lab spend, per year. So we have that leverage. So when you combine the leverage and the data, it makes for a winning combination.
Well, and then one last thing on all this, it feels like it would be adversarial with suppliers, but I've actually seen partnerships with suppliers, and I'm curious just to hear how that works. Like, what's the opportunity for suppliers to be collaborative in this type of a cost savings venture where it's actually good for them as well?
Right. And I mean, theoretically, every negotiation should end up in a win win situation. Otherwise, one party has much more leverage than the other. So the key is to level that playing field. And so that's why I love what we do, because we get to be a partner to the health system who generally is working with multi-billion-dollar lab vendors, right? Who have a lot of leverage all on their own. And then the healthcare supply chain system, the way that a lot of the agreements are negotiated, that would be a conversation for another day and a six pack. But we like to partner with those health systems to give them the data and the leverage to level out that playing field when negotiating with those multi-billion-dollar manufacturers. And so when done right and when done correctly, the vendors will provide a high quality product on time, helping the health systems with just in time inventory, with high quality products and an aggressive price that doesn't have to go up 3 to 5% per year. Back in my manufacturing days, when we would enter into a 7 or 8 year agreement, there was a 3% cost decrease every year, not a 3% cost increase. So I think that, I hope to see the day when the agreements going forward are more in favor of the health systems, where they have those collaborative win-win solutions with the manufacturers, that, hey, if we're gonna partner with you for chemistry, if we're gonna buy reagents from you for the next 8 years, we're going to go spend tens of millions of dollars in our capital equipment and automation to put your equipment in our facility. I want my cost to go down every year by 3 to 4%. And the
Yeah,
manufacturers could do it because
yeah.
their costs aren't going up, their costs are going down. They
Yeah, and
don't
I
play
would
the same game.
suggest right, and I would suggest AI and the use of agentic AI actually on both sides end up making everything more streamlined. And you touched on this, the value of the human touch from a uh, buyer's procurement perspective is to then work to collaboratively change contracts. And it's not like one, at least not anytime soon, one agentic AI isn't going to talk to the other agentic AI to just, negotiate it. And then the humans are just
Right.
at the beach, like there will be a conversation. Okay. Well, as we round the corner here into the conclusion of this episode 30 of Boombostic Health, of course, HC1 is headquartered in Indianapolis, the home of the Indiana Pacers. And we are up in this series against Oklahoma City, which I think is shocking everybody. We took a game on the road. Of course, they beat us, and then we beat them back in Indy. So we're up 2-1 at this point. And I'm just curious to know, are we going to win? What do you think, Brent?
Well, uh, if I was a betting man, I would say yes.
All right,
And
there
I
you
hope
have
that
it.
you
I
do.
love it.
Well, I hope that we do, right? I've got now I have loyalty to Indianapolis, and I really am rooting for you and the team.
Yeah, thank you. No, go Pacers for sure. Well, thank you so much, Brent, Professor Bolton, Dr. Professor Bolton, for being back on the Boombostic Health podcast.
You bet.
It's great to have you as part of the community here. Awesome work that you're doing out there to make healthcare more efficient. And I'm so thrilled to see what we can do with AI as we move forward to unlock even more value for healthcare. So have a great rest of your day. And thanks for being on.
Thanks for having me. Take
And
care.
thank you, everybody in the community out there, for being here for another episode of Boombostic Health. We'll see you next week. Have a great day.